calculation and evaluation of anthropometric status. So first, what is school hygiene and what are basic tasks and activities included in these chapters? School hygiene, studying the school environment and its conformity with the basic hygiene requirements, standards and regulation. And this is not only school, but also preschool. Actually, kindergarten are also included here. Development of hygienic standards for the school environment and for the teaching process, conducting hygienic audits of preschool and school institutions, school kitchen and student dormitories, and improvement of school environment, microclimate, classroom furniture, and equipment. Also, supervision of school program and mode of the studying and rest. So it's very important the schedule not to be such a busy schedule like today, from morning, early in the morning till late in the night. So it's important to have a balance between studying and rest. Assessment and monitoring the physical and physiological development and health status of school children and adolescents. And elaboration of standards for the growth and development and promoting and teaching healthy lifestyle. It's important that school hygiene is more directed on prevention and health promotion. And this is, all these standards are related to healthy children and adolescents. What is the definition of growth and development? Growth is the progressive increase in the size of child or parts of the body of a child. There are specific standards. And development is the progressive acquisition of various skills. Growth and development go together, but at different rates and speed, of course. And this is the front page of the WHO Growth Standards Manual. Importance of assessing growth and development. It's a very helpful in establishing the health and nutrition status of a child, especially during the first year of life. Growth and development, it's a very strong, there is a very strong relation or correlation between health, nutrition, and development. Stable normal growth and development indicate a good health and nutritional status. And abnormal growth and growth failure is of symptoms of disease or undernutrition. And measurement of growth is an essential part of the physical examination. And in your lesson of pediatric, maybe next, I think it's next year, yes, you see that there are two parts of pediatric. There is a preventive pediatrics, and preventive pediatrics is dealing with health children, and is measuring and evaluation the standards and growth and velocity of growth and development. And another part of pediatric is dealing of treatment of non-healthy or sick children. Factors affecting growth and development. There is genetic, environmental factors. There are very strong, of course, genetic is, if there is not a good genetical background, if you have positive and good environmental factors, this is more optimistic. The growth and development of the child is more or less adequate. The genetic factors determine the potential and limitation of growth and development. But this potential should be developed through environmental factors. The favorable environmental factors such as adequate care and nutrition support the achievement of the full genetic potential of growth and development. I think that I mentioned you during the calcium metabolism or something, calcium nutrition. I told you that if you have a normal diet, it means normal intake of adequate intake of calcium and other minerals and vitamin K and proteins. You have and also adequate physical activity, because physical activity it stimulates bone health and development. So you have a chance to develop your potential, optimal development of your potential, and to prevent your skeleton of osteoporosis. So this is environmental factors and genetic potential, but it should be stimulated through adequate, regarding osteoporosis, adequate nutrition and physical activity. Unfavorable factors acting alone or in combination slow or stop growth and development. For example, malnutrition, of course, infections, congenital malformations, hormonal disturbances, disability, lack of emotional support and stimulation, especially in infants and early childhood. Emotional support and stimulation are extremely important together with nutrition, normal nutrition. Lack of play and language training. All this play and language training is included in emotional support and stimulation during the early childhood. Unfavorable factors to promote optimum growth. The unfavorable environmental factors can be removed or minimized. Once they're removed, there follows a period of catch-up growth. So if you are able to identify the risk factor and these negative factors for development, they can be removed, and there follows a period of catch-up growth. Catch-up growth is characterized by high velocity above the limit of normal for age for at least 1 year after a transient period of growth inhibition. And this growth rate continues until the previous growth pattern is reached, and then the growth rate decreases to the normal rate determined by the individual genetic factors. So there is still an optimism in the early childhood if these negative factors are removed or identified and controlled. Although catch-up growth can be expressed in terms of high velocity, the change in high standards deviation score is more appropriate. You know that you have this growth chart, WHO growth chart for children, and the indicators are length for age, weight for age, and length for weight. And the measurements are standard deviation or Z-scores or percentiles. So it means that this is compared to the value is compared to the standard population, well-nourished standard population. A child genetically determined to be tall grows slightly more rapidly than a child genetically determined to be short. Also, a child genetically determined to be smart develops their intellect more rapidly than a child genetically determined to be less intelligent. But everything is individual, very individual. Children develop very individually in this period of time. And also, it's important, I told you, I already mentioned, the stimulation and care. Growth monitoring is the process of maintaining regular close observation of a child growth. During the first 3 months after birth, the measurements are, the mother with the child visits medical doctors every month, every 30 days. And then after the first 3 months, there is every 3 months the visit. Of course, different countries, they have different standards for early child care, but in Bulgaria it's every month during the first 3 months of life. It starts with measurement of weight daily, weekly, monthly, bi-monthly. The successive weights are plotted on the broad chart of the child health card. And to monitor growth, a growth chart has been used. And during the first year of life, another indicator compared together with weight and height are head circumference and breast circumference. Growth monitoring. Health workers and parents should monitor the growth of child for the following reason: for early detection of abnormal growth and development, to facilitate the early treatment or correction of any condition that may cause abnormal growth and development, and to provide proper and on-time health advice for the prevention of malnutrition. And not only malnutrition. For example, if the child has some problems with a pulmonary system or with circulatory system inherited, or some hormonal abnormalities at birth, when there is a delay in development and growth, it can be put a diagnosis as early as possible. Development, so this is about growth and development, and I think that go to the manual and there is much more extensive information about this chapter, especially growth and anthropometric status and how the measurements are performed and what is the difference between infants and early childhood. It means during the first 4 months of life, and then so you can read it. Development is the progressive acquisition of various skills, abilities such as head support, speaking, learning, expressing the feeling, and relating with other people. Each child follows an unique path in growth and development, and this is laid down from the beginning of life by what he has inherited from both parents. Many factors might change the genetically determined path of growth and development. This is infection, lack of care, psychological trauma, bad education of the caregivers, and malnutrition. So it's not pessimistic if there is not such a perfect genetical background. There is still chance the child to develop properly. The normal well-fed infant who is protected from infections develops quickly, particularly during the first 3 months. It's very important to know the age range when most children acquire certain skills. And this is also apart from pediatrics, but because we are speaking about prevention and about child hygiene, it's important to know the various skills the baby and young child learn are called milestones. In monitoring development, we notice at what age the child achieved various milestones, such as smiling at the mother, smiling without, sitting without support, grasping object with hand, standing, walking, talking, everything. So, and this is the normal development milestone. At birth, motor development, when prone, turns head to avoid suffocation. And the language, it cries. Between 3 and 6 months of life, good head control, and this is about healthy and well-developed child without any health problems. Can follow an object with eyes, plays with hands. Between 3 and 6 months of life. Between 6 and 9, can sit unsupported, grasp actively, makes loud noises. And between 9 and 12 months, able to stand, of course with help and support, understand a few words, try to use them. And between 9 and 18 months, able to walk, grasp small objects with thumbs and index finger. And then between 15 and 30, during the second year of life, able to run around as much as he wants and can say several words or even some sentences. Smart children can speak with sentences at the age of, let's say, 2. And this is one an indicator that the child is really correctly developed. And 3 years, plays actively, is able to jump and climb, starts talking a lot, is curious and asks many questions. And this is the age when children should be, this question should be answered by the caregivers, mothers, grandmothers, and so on. So it's not enough the child to be exposed to TV or to a computer games or audio play. So it's important to have a communication between the caregiver and a child in order to support proper development. And factors that promote proper development. This is good nutrition. Most other organ in the body, the brain is not fully developed at birth, and that's why stimulation is so important. Good nutrition in the first 6 months of life is extremely important, and you remember that during this period of time, exclusive breastfeeding is encouraged. Malnutrition in this period may inhibit the growth of the brain, and also some trace elements and minerals malnutrition, such as iodine, zinc, iron, they are crucial, and vitamin D, of course. And this is emotional support. It's, I think that time is, yes. Emotional support. The first 5 years of life are critical for the foundation of the skills which are developed in the following period of the child life. The newborn learned a great deal during the first year of life. It's very important to realize that the child is a growing and developing human being, and he ought to be treated very carefully with love and respect so that he can develop normally. And I think maybe you already heard about so-called mirror neurons in the temporal part of the brain. So it's it means this neuron ensure that the child can repeat the action or the interaction with the caregivers or with the mothers. So if it's positive, if the mother is smiling or the person is smiling, the child also smiles. If he's nice and loving, the children express through these neurons, they repeat the same action or interaction. So it's not only for young children, for everybody. If you are positive and smiling, the people reflect. This is you can expect the reflection of your behavior, of course, but it's absolutely important during the first couple of months of life. And what is emotional support? The child needs emotional support. There are 8 basic needs for a healthy emotional development of a child. This is love, security, acceptance as an individual, self-respect, self-esteem, achievement, recognition, independence, and authority. So remember these 8 basic needs, because these basic needs, they're not only for children, they develop further in life, and all of us expect from the other all these 8 basic needs to be satisfied. Language training. Another thing, what is very important, is another factor that promotes development, is language training. Children should be offered opportunities to meet, use, and play with words in conversation and in reading books, using an adult language. This is very important, not to use different words, childish, and to behave childish, but it's important to use the adult's language. The adult should talk and sing with small children and infants, encourage them to talk about what they are thinking, not laugh when children are talking, read to the children, tell stories, and listen attentively to the children as they listen to the other adults. So this is very important, to behave or to treat the children as an adult with respect. This is maybe you know from social medicine what is the difference between incidence and prevalence, definition and differences. Incidence is the number of instances of illness on commencing or persons becoming ill during the given period in a specified population. It means this is the all new cases that are registered. Incidence usually means something that is measured within a set of number of people and in a time period. incidence can tell us how many new cases of a particular illness have been suffered by a community, or it might tell us how patterns of condition with the population change over time. And this is a new cases per 100,000 in 1 year. This is a standard statistical procedure. It's epidemiological measure. Incidence measure our rate of occurrence of new cases, and incidence is calculated as a number of new cases of a disease or condition in a specific time period divided by the size of the population under consideration who are initially disease-free. And this is usually this is the number of the total population. For example, the incidence of meningitis in the UK in 1999 could be calculated by finding the number of new meningitis cases registered during this year and dividing the number of the population of the UK. So this is clear, I think. And the prevalence is a frequency used epidemiological measure of how commonly a disease or condition occurs in a population, and how much of some diseases or condition there is in a population at a particular point of time. For example, the prevalence is calculated by dividing the number of persons with a disease or condition by the number of individual exams. For example, this is again on 100,000 population, and this is standardized rate because it should be compatible to the world statistic. The prevalence gives figures for a factor at a single point of time. For example, we may want to know how many children are overweight in a country by measuring the height and weight of every child of a particular age in a sample of children and calculating their body mass index. We will have some idea of how many children at that point in time in that sample of children are overweight. It's not necessarily new cases, but this is the total number of obese children in Bulgaria, for example. How to use incidence and prevalence, morbidity rates such as disease incidence and disease prevalence are core indicators of public health and healthcare needs of the population, and these are a basis for establishing or developing strategies and preventive programs. And for simulation models designed to make projection of future population planning and developing a program and in public health. So it's very important to use them for making projection, how this situation will increase. And this is, of course, it's not related to the current lecture, but you know that every morning they are discussing on the TV about the COVID-19, what is the situation here and how is in Europe per 10,000 new cases per 10,000 population, and and also the projection if the rate of increasing of this new cases, it's the same. What's the number of total COVID patients in 1 month, in 2 months? And this is very important in order to evaluate or to assess the capacity of healthcare system, because this is important in order. And also now they start calculating or projecting the number of people, the vaccination related to vaccination, and what is the time period needed in order to reach 70% vaccination or protected people meeting with this virus through vaccine or through disease. What is analyzing of incidence and prevalence of children and adolescents? It's important hygiene and medical and social indicators, and also determining the health and social needs of the population, and the development of program for disease prevention and health promotion. This is to study the incidence. This is, for example, through studying the incidence, the reduction of complete or to complete eradication of infectious and parasitic diseases: polio, diphtheria, typhus, whooping cough, malaria, tuberculosis, disease related to malnutrition, dystrophies, vitamin deficiency, rickets, and usually they are calculated as incidence rate. So it's if the incidence rate decrease, it means that there are adequate strategy and the healthcare system is adequate to the diseases, to these diseases. This is the estimated tuberculosis incidence rates in 2012. And this is the WHO standards figure map of different statistic and diseases. This is Bulgaria. This is between 0 and, I mean, it's yes. This is between 10 and 19 per 100,000 population of tuberculosis. But I think that during the last couple of years, this situation changed. And now I think that if you decide to go to specialized pulmonary diseases, you'll have a broad field of research and work after this COVID epidemic, because I'm afraid that it will increase the prevalence of chronic pulmonary diseases after this epidemic. What is the structure of disease incidence among children? Respiratory diseases, of course, diseases of nervous system, ocular analyzer when they start working, going to school, diseases of the skin and subcutaneous tissue, infectious diseases and infectious accidents, poisoning, and infectious diseases are more common between 11 and 14 years, and traffic incidents between 15 and 18 years, when children become more independent school children. And of course, this is important now because some infectious diseases are eradicated, and some chronic non-communicable diseases, they appeared and they become younger. I mean, even in the childhood, there are cardiovascular diseases, arterial hypertension. In Bulgaria, according to the protocol, general practitioners start measuring blood pressure at the age of 5 during the childhood. You see how metabolic syndrome, metabolic diseases, type 2 diabetes is also become younger and younger, obesity, allergic diseases, neuropsychiatric disorders, anxiety disorders, behavior disorders, mood disorders, substance use disorders. You know that this lockdown has a negative impact on neuropsychiatric disorders and diseases, anxiety, deprivation, behavior disorders. So maybe it's better to open the door and to have more face-to-face communication than this kind of communication, because it has a negative impact. Also cancer disease, especially in childhood, as leukemia, brain and other central nervous system tumors, neuroblastoma, lymphoma, retinoblastoma, bone cancer. These are very, very aggressive, and unfortunately, when they appear, and they're very typical in childhood, they're very aggressive with a fatal outcome. Chronic diseases of the respiratory and digestive system, that they're not so often. And factors for the occurrence of chronic non-communicable diseases at school. Related to school environment, this is inadequate furniture, musculoskeletal system and scoliosis, dust and microbial contamination. Just remember what was microclimate, so it's the same microclimate inside, indoor. Inadequate physical environment, lighting, heating, ventilation, noise, and the results are spinal deformities, vision abnormalities, neurosis. Negative factors from at school, also poor organization of the teaching, excessive workload, mental strain, psychosocial stress, reduced sport activities, less gymnastics hour, inadequate nutrition, excessive eating, saturated fats, label salt, sugar, processed foods. Because children are using this, especially school children, this vending machine. The situation with nutrition is better in preschool, in kindergarten. And because it's controlled, and the food is prepared according to the standard and specific recipes. But in school, when children become more free to make their selection, the role of family and the role of parents is very important in order to teach or to control and to establish eating pattern and eating behavior of the child in order to be healthy. Another factors at home: poor indoor environment and family environment. Physical and psychical diseases, obesity and undernutrition, tuberculosis, neurosis, transitional and permanent mental disorders, hypertension. Also behavior risk factor. This is more often in upper school: smoking and alcohol abuse, early appearance, and the use of drugs and drug abuse, and risky sexual behavior. They start at the age of 12, 13, 14. So it's also, this is important. The environment, school environment and family environment has a substantial impact. Also social economical factors: poor living condition, low living standards. And it's funny because in our country, it's now this year, previous year, starting from March previous year, and now during this lockdown, our state authorities or government, they realized that there is such an inequality between children, because according to this online education, every child has to have a computer or laptop or these devices in order to perform or to adequately contact with teachers. And they realize that in families, when there are 2 children or 3 children, there are some families that they cannot afford even to pay the internet or to have a lot of devices, or so it's there is no any discussion about malnutrition or undernutrition or bad poor living condition, but it's funny that we discovered that there is something wrong in our new so-called new society, this inequality. Anyway, urbanization, because you have also a question in the syllabus about urbanization, and urbanization, a positive and negative effect of urbanization. Negative effects are high population density, stressful lifestyle, environmental pollution, transport, also noise, also incidents, traffic incidents. So urbanization, of course, positive is better living condition, higher standard of education and healthcare, and more social activities and sport opportunities for organized sport activities, cultural life, but this is a positive, but this is urbanization has also a lot of negative. Ecological factors, use of chemicals, antibiotics, environmentally related diseases in children. There are allergy, autoimmune diseases, and others. And obesity. Obesity, you know that this is a key activity or key focus or target of the European Commission to reduce childhood obesity or to stop increasing the number of obese children in Europe. Childhood obesity predisposed to insulin resistance and type 2 diabetes, hypertension, hyperlipidemia, liver and renal diseases, and reproductive dysfunction. So this condition increases the risk of adult onset obesity and cardiovascular diseases. And that's why it's important to manage this problem in childhood. Is easier to manage this problem in childhood than to make it when the child is 18 or 20 years old. Many factors, including genetic, environmental, metabolism, lifestyle, and eating habits. Also, more than 90% of cases are idiopathic, less than 10% are associated with hormonal or genetic causes. Change in diet and eating patterns when starting school, overfeeding and hypokinesia, increased workload, irregular meals, inadequate diet, and formula feeding in the infancy, early introduction of complementary solid energy-dense food. And that's why it's very important family eating pattern to be regulated. You know that it's not recommended children to be advised to keep a diet with reduced energy intake, because reduced energy intake or decreasing energy or kilocalories can lead also to some micronutrient deficiency or also to protein deficiency. That's why it's in order to ensure balance, to ensure negative balance during childhood, it's important to increase physical activity, to the child to be involved in sport and at the same time to keep adequate essential nutrients intake. So this is the difference between dietary approach or dietary advice for young children, for children, and for adults. Because adults, they must have a reduction of 500 kilocalories per day in order to reach a negative balance. And for a child, it's important to increase physical activity, and this way to ensure this slightly negative balance without changing the density of the diet. Epidemiology of child obesity. International data reporting childhood obesity varies, but in 77% of the countries analyzed, the prevalence rate for children who are overweight was at least 10%. The highest rate for children at risk for obesity were found in Malta, 25%, United States, 25%, Lithuania, 5%, Latvia, 5% had the lowest rate. A recent European Young Heart study suggests Swedish children have a lower risk of becoming overweight because it's very cold there in Sweden, and they're very fit, they're very, very active, and they really put physical activity as a priority of their educational system. Because of this very unpleasant climate, you know, people there should be absolutely fit and strong and active, physically active, in order to survive at minus 20 degrees. I remember I was 25 years for 1 month in Stockholm for a training course, and the temperature was minus 25 degrees all the time. Can you imagine this? But they manage the situation because there have perfect transport, perfect heating system. Everywhere is well controlled. Anyway, in Europe, 22 million children are overweight, 5 million obese, and also 50% of the EU population is overweight, and 6% of healthcare costs of EU countries are spent on disease related to obesity. And there is, if there is obesity during the childhood, 25% remain overweight for lifetime. And primary obesity is alimentary. More than 90% of obese children can be nutritional, which relate to improper diet or exogenous constitutional past by descent from parents, and alimentary most likely to occur at this age. At 3 years, between 5 and 7, because they started, this is physiological increasing of fat mass at this period of time. And 12 to 16, this is the beginning of puberty. So usually between 12 and 16 children, adolescents, they start taking more attention, keeping more attention on their body weight and appearance. And in this age is the higher prevalence or the higher proportion of adolescents with anorexia and bulimia, because they're overweight, but at the same time they start taking care on their body appearance. And secondary obesity, this is disease of adrenal glands and thyroid. Criteria for determining obesity in children today are still under discussion by specialists. Also brain injury and brain tumors, meningitis, encephalitis, so other diseases. But if you decide to be an endocrinologist and child endocrinologist, it's important to exclude any endocrine diseases and then to put the child on a specific diet or physical activity regime. Complication, it's, this type 2 diabetes, hypertension, hyperlipidemia, accelerated growth and bone maturation, ovarian hyperandrogenism, gynecomastia, cholecystitis, pancreatitis, also orthopedic disorders, genu valgus, slipped capital femoral epiphysis, liver and gallbladder dysfunction, psychological complication, cardiovascular and endocrine complication. There are a lot of obesity-related diseases, and this is the long-term complication. Of course, gout and colorectal cancer and psychosocial dysfunction. This is childhood obesity, and what is important, what is the solution? The solution is healthy eating, movement, and so it's very important 3 hours per day about physical activity level. But this is important to identify child obesity and to diagnose child obesity as early in life as possible. It means after. Okay, and this is the EU preventive strategy for reduction of obesity. It's important to change children's behavior in the field of physical activity and balanced diet. Restricting sponsorship and advertising in schools of products high in sugar, salt, and fat. Restricting advertising to children of foods with low nutritional value. And this is voluntary, and it's still voluntary. Food labels are a key element in the promotion of health. The label must be visible, clear, and easily understood by the user, and to include mandatory information on energy content. So, nutrition education at school, even in kindergarten, it's important. Important role plays the food industry, of course, controlling the portion size, offering a wider range of smaller portion, clear information on the label, regulatory change in all aspects of child nutrition recommendations, standards, formulation. Of course, reduction of VAT on fruits and vegetables. In some countries, for example, in UK and I think in Canada as well, they increased the VAT for soft drinks. And of course, in Bulgaria, it was also tried to change regulatory the VAT for Coca-Cola and other bottling company, but it was not very successful. Ban on industrially processed trans fats in school campaigns and control on food quality and nutritional standards in schools and kindergartens. So specific recipe and specific list of recommended foods allowed and ban some reduction offering, decreasing or reducing offering of some unhealthy foods like chips and crackers and soft drinks and sugary drinks, everything that's high in fat, sugar, and salt. And a little bit, some slides about eating disorders, because I mentioned that it's very important. This is a critical period of time between 12 and 16 years of old, both male and females, and usually they become a little bit overweight or obese, even not obese, but overweight. And eating disorders are very common in this age. An increasing number of individuals and reduce the age of people with eating disorders. That is most common among persons 14 to 18, but 10% are less than 10 years old, because we are speaking a lot about healthy diet, about fashion, about some well-looking models, and that's why children they become with eating disorders early in life. Difficult to diagnose anorexia in children, more difficult to articulate, because sometimes it's with depression, stomach pain, delayed growth, so it's a little bit difficult. And you know that these eating disorders, they are managed with specialists in internal medicine, gastroenterology, dietitian and nutritionist, and also psychologists or psychiatric. This is the dynamic of incidence of anorexia nervosa. Look at this. 1930, 1939. This is around before the Second World War. Only 0.1%. 50, this is 50, 59 after the Second World. People are starving, people are trying to find food. So there is no problem with anorexia, 0.4. And now 1999, 5.4. So this is more or less availability, accessibility of food, and also food promotion of unhealthy food, increasing the offering and production of industrially processed foods, everything that makes life better, like chocolate and candies and everything. So factors, psychosocial factors, exogenous low self-esteem, a family psychological climate, depression, and of course, there's also endogenous family history, imbalance of serotonin and other neurotransmitters. And there are some risk groups. Athletes, dancers, they have to increase their physical activity and to reduce food intake in order to keep their body weight and body shape according to some standards. And also there are social factors like stereotypes and fashion trends, media pressures, and everything that can influence, because children and adolescents are very sensitive to influences. They're much easier to influence them in order to change their behavior. Anorexia, it's 10 times lower among men. I don't know, maybe men are smarter than women. I don't know. I don't believe so. Okay, voluntary, persistent, progressive, and strong restriction and energy intake combined with intense physical activity leading to emaciation and atrophy. Preoccupation with weight, food calories, fat grams, and dieting. Anxiety about gaining weight or being fat. The diagnosis is verified by the progressive loss of weight up to 25% of normal. It means that less than 85% of expected. And you remember that the body mass index, this is body mass index below 18.5. This is the below the lower standard. The children standard growth is diagnosed by premorbid percentiles high for age. So this is, but in children it's not very common. Usually it's among young ladies. A diagnosis, distorting the image of his own body or any parts, amenorrhea, 3 consecutive cycles, depression due to caloric restriction, and obsessive behavior provoked by certain foods. Usually they're afraid to eat candies, to eat cheese, to eat meat, and they think that they are really fat, and actually they are thin and lean and even starving. In childhood, this is a strict dieting for weight loss, a critical attitude to his own body shapes, increased social isolation because they usually are depressive and they don't like, they are suspicious to other people and then don't like to share their eating behavior to others. Usually they skip meals, breakfasts, dinners with family. Usually dinners with family is more difficult to be skipped, but usually breakfast and lunch they skip in order to keep their body shape. Menstrual disorders and application procedures for cleansing along with dieting. And at the same time, active physical activities, because these physical activities, this support, this helps releasing endorphins, and they keep happy. If you are keeping a diet for 3 or 4 days without food or very restricted food, you will see that you don't feel hungry. So the adaptation of your metabolism is a different level. This is it? No, what's happened here? I don't know, maybe. I wanted to say about, this is anorexia, but bulimia is usually they have a normal body weight, but they have some period of not eating, of dieting. And then they feel guilty when they start eating again, then feel guilty, and they are trying to somehow to throw out this food. Hypertension. There is another problem for of childhood is hypertension. There is a primary essential of juvenile, slowly in progress and persistent. And it's very important to diagnose early in childhood if there is essential, this primary hypertension. And secondary diseases in the kidney, vascular, endocrine origin. Its treatment, it starts with change in lifestyle. If there is a reason to change a lifestyle, I mean, reducing salt intake, sodium intake, and processed foods, diet modification, and reduction of body mass if there is overweight or obesity. Neuromental disorders, headache, tiredness, insomnia, anorexia, also emotional disorders, depression, hypochondria, and behavior disturbances from aggressive to passive aggression, violence, uncontrolled behavior, suicidality, conflict, and drugs abuse. Also spinal deformities, most often in primary and secondary school, increasing at age between 7 and 11 years when they started school at first 4 years of school. Inadequate school furniture, heavy and asymmetric weights, improper posture while reading and writing, urbanization, hypokinesia, improper posture while reading. This is okay. I'll correct before sending it to you. Traumatic injuries, lack of experience, immature musculoskeletal system. Also, there is a poisoning in this age. And the preventive measures, health education and strong relation, strong bond between family and school, regulatory measures, of course, related to nutrition, related to physical activities and school programs, and creating safe living and school environment, it's very important, and combating traumatism. And main activities of the physician for proper development of and welfare and wellness for children and students. Prevention through health education, active lifestyle, actively identifying children with disorders, hypertension, obesity, spinal deformities, visual disturbances, and imposing healthy behaviors. So in Bulgaria, maybe 30 years ago, we had the school medical doctors. And preventive programs, not only, the prevention was at a higher level compared to now, because now, according to new healthcare system, we have these family doctors, and family doctors or general practitioners, they're in charge for children, for adults, and for everybody. And at the beginning of each year, the child should be contacted with, the family should be contacted with the family doctors, and they have to perform or to make these preventive measurements and assessment of health status and anthropometric development of the child. But and then with this file, children go and they have this file, and these files are available at school. But if there is no nurses or medical doctors, no one follow up the status of the child. This is more or less responsibility of the family, of the parents. So this is, of course, there's some program for nutrition program in preschool, in school. This is something positive, but physical activity in Bulgaria, especially among children and among adolescents, it's more or less responsibility of the family. And if the family is not economically strong in order to ensure skiing in winter and swimming pool in summer, it's very difficult to keep adequate physical activity. But anyway, it's very important, and we have to educate children and families and everybody how important is this for health and for the future health. Okay, I think this is, I'll correct some mistake in this presentation, I realized. And if you have any questions, when you start preparing yourself for the exam, please don't hesitate. You know my mobile, you know my email address. So write down, ask question. It's better now to ask question before the exam than later to be disappointed. I hope that everything will be okay with you. But keep in touch. If you have any changes in your idea about these dates, please inform me at least 1 week before.
Professor.
Okay, and thank you. Yes. Yes, Sutiris.
Yes, just one thing. I just realized that some groups, they have some practicals on Monday morning on that we agree for the exam. So the other possibility, it will be on Wednesday. I told to these groups 5 and 6 to ask if they can skip the practical classes in the morning. So
what practical classes do they have?
They have surgery and